SI joint relief. I'm going to show you how to eliminate SI joint pain in just 10 minutes a day without ever having to leave your home. I know how frustrating it is to be stuck with constant sacroiliac joint pain and limited mobility. That's why I'm sharing 5 of the best lower back strengthening and stabilization exercises that target the SI joint pain, and you won't even need equipment. These are the same exercises that have helped thousands of my patients get real relief from SI joint pain without medication or surgery. In addition, stay until the end of the video, because as a bonus tip, I'll also tell you the common exercises that you should avoid when suffering from SI joint pain. Let's get started. In a moment, I'm going to demonstrate how to do these 5 exercises, but first, let me explain why I chose strengthening and stabilization exercises. I chose these exercises because they directly target the force closure mechanism of the SI joint, which is key for effective pain relief. Here's how it works. The SI joint relies on surrounding muscles to create stability through force closure, which is basically the muscle-generated compression that keeps the joint steady and aligned during movement. Without adequate stability from these muscles, the SI joint can experience excessive movement from stress, leading to pain and discomfort. By strengthening the core and the lower back muscles, these exercises enhance the stabilizing force around the SI joint, providing it with the support it needs to move comfortably and without strain. Over time, this leads to improved SI joint function and significant pain reduction, making these exercises a powerful drug-free solution for SI joint pain. Okay, exercise number 1 is going to be the glute bridge. So you can do all of these exercises laying on the floor on like a yoga mat to help make it a little bit softer. But for the glute bridge, we're gonna start lying on our back. You might wanna put a pillow behind your head to make you a little bit more comfortable. Knees are gonna be bent, and all we're gonna do is we're gonna push our feet into the ground, lift our pelvis, hold for 5 seconds, and then we're gonna come back down. And we're gonna repeat this 10 times. So 1, 2, 3, 4, 5, and we're gonna come down. You should feel some strengthening in the front of your thighs as we start to use the quadriceps to lift up, and also the glutes. We wanna squeeze the glutes, keep them nice and tight to help secure the SI joint as well. And again, 10 reps, holding each one for 5 seconds, and you only need to start with 1 set. So that's number 1 is going to be the glute bridge. Exercise number 2 is going to be the prone plank. So this is where we're really gonna work on a lot of our abdominal strength. So again, you can do this on the floor. We're gonna start with a modified version. So we're gonna start on our knees, come down onto your elbows, keep your back nice and flat, and we're just gonna hold in this position for about 30 seconds, counting nice and slow. We really want to work on contracting the ab muscles to really help hold the lower back in proper position and strengthen around that. Now, if starting on your knees starts to get too easy for 30 seconds, you can start to do a harder version, which is going to be, again, on our elbows, but we're going to instead come up on our toes and hold for another 30 seconds. Again, we want to keep your back nice and straight, keep your glutes strong and tight, and hold your abs as tight as you can for 30 seconds. So that's gonna be exercise number 2 is gonna be the prone plank. Okay, exercise number 3 for strengthening and stabilizing the SI joint is going to be the bird dog. So we're gonna start on this one, on our hands and knees like this. We're gonna take our left leg, it's gonna come straight out. We want our arms to be right below our shoulders, and then we'll go right arm straight. And all we're gonna do is we're gonna bring our elbow to the opposite knee, hold for a second and come back. Hold for a second and come back. And we're gonna do this a total of 10 times. And then we're gonna repeat on the opposite side. So we're gonna go right leg straight, left arm straight, and bring the elbows in. And again, the whole time we wanna make sure we're keeping our abs nice and tight to keep our back straight and keep our arms nice and straight to help stabilize that SI joint. Again, 10 reps on each side, holding for about a second when we go elbow to knee. So that's exercise number 3 is gonna be the bird dog. Okay, exercise number 4 is going to be side lying hip abduction. So we're taking our hip away from our body. So what we're gonna do is we're gonna start on our side for this one. You just let your head rest on a pillow. We want both legs to be straight. And what we're gonna do is we're gonna take our top leg, we're gonna pull it up as high as we can, making sure we keep it nice and straight. Hold for about 3 to 5 seconds and come back down. And we're gonna repeat this for 10 reps. hold and come back, and you're gonna feel a lot of burn deep into that glute muscle. That's the muscle that attaches to the SI joint, so we wanna keep it nice and strong, and that's where we're strengthening here. Now, once I've completed 10 reps on my right leg, I'm gonna roll over and do the exact same 10 reps with the left side. We always wanna make sure we're doing strengthening exercises on both sides evenly. We don't want one side of our body to be stronger than the other. So again, hold it in the air for 3 to 5 seconds, 10 reps on the right leg, roll over, 10 reps on the left leg, and that sideline hip abduction. Okay, exercise number 5, the final one we'll go over in this video, is gonna be hip adduction. So we just did hip abduction, where our hip was going away. This is where we're gonna bring our hips together. So this is the only exercise that we're going over that you'll need any type of prop. So I'm gonna use a bolster for this. You can use at home, you can use a pillow, kind of fold it in half. If you have like a kickball, that's a perfect size. So what we're gonna do is, this is gonna be similar position to starting the glute bridge. So we're gonna lay on our back with a pillow securing our head, and we're gonna take our pillow, our ball, whatever we're gonna use, we're gonna put it right between our knees. Let's bring our feet together. And all we're gonna do is we're gonna squeeze our knees together. So squeezing the bolster, and I'm gonna hold for 10 seconds. And then I'm gonna relax. And then I'm gonna repeat this again for 10 reps. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. And you're gonna feel a lot of burning in the interior thighs, probably into the groin as well, as we really squeeze as hard as we can into the pillow or the ball, whatever you're using. Again, hold for 10 seconds, 10 reps again, and that's gonna help stabilize and strengthen our SI joint. So the final exercise, that was hip adduction, and now you have 5 exercises to help strengthen and stabilize your SI joint. These 5 exercises are essential for the stability and strength your sacroiliac joint needs for lasting pain relief, and they're simple enough to do anytime, anywhere. Remember, progress comes with consistency, so don't hesitate to revisit this video whenever you need a refresher or extra guidance. Your SI joint will thank you. And now for your bonus tip. Knowing which exercises to avoid is just as important as knowing which ones to do. For SI joint pain, steer clear of activities like running, squats, lunges, or any high impact exercises like plyometrics. These exercises place excessive stress on the SI joint, which can lead to more inflammation and, as a result, more pain. Running and high impact activities involve repetitive jarring motions that strain the SI joint with every step. Squats, on the other hand, require intense hip and pelvic stability, which can overload the SI joint if the surrounding muscles aren't strong enough to support it yet. Avoiding these activities allows the joint to heal and prevents aggravating the area as you build up strength and stability with safer, low-impact exercises. Now that you know what exercises you can do to stabilize the lower back and SI joint, and which ones to avoid, I want to hear from you. Which stabilizing exercises did you like the most? Was it the glute bridge or maybe the bird dog? Let me know in the comments below. If you find value in this video, like and share it, and remember to subscribe to my channel for more tips and strategies to help you achieve lasting relief, improve your mobility, and regain control of your life without relying on medications or surgery. The next video you should watch in my SI joint series is this one, Sacroiliac Joint Pain, Why It Hurts So Bad, Causes and Treatments. If you want to learn more about the SI joint and how to treat it for permanent relief, go watch this video next.